I am Rosanna Taricone, Director of Master of International Healthcare Management, Economics and Policy that is run by the Bocconi School of Management already for 12 years now. I'm very happy to introduce the first international case competition on healthcare management and economics. We have invited to attend master programs in healthcare management, health policy, public health, master in public management, master in public health, but also PhD students and MBAs. Each team is composed of 4 students and an academic advisor. Teams are required to make a presentation in no more than 30 minutes in front of a 3-member jury panel. The jury panels are composed of different people coming from different backgrounds and perspectives. And I must acknowledge the very important contribution that we got from a global pharmaceutical company, which is Novartis Pharma. Novartis Pharma is a co-sponsor of this initiative, together with the Bocconi School of Management, and it is also, and more importantly, the case that we are discussing today and tomorrow. The competition is a 2-day competition. The students and the teams will be required to make the presentation twice, today and tomorrow, in front of different jury panels. The 3 last teams of students finally competing for getting the first place and the final award of 5,000 net euro prize. I do hope that with this introduction you will get as excited as I am about this competition, and I'm looking forward to see you all for the next edition in 2012. Goodbye.
Okay, so please behave. So you can see the grand total on your right. Please let me say something. These are the quantitative scores. However, jury members in most cases have also written down some qualitative judgment and notes. Obviously, you are more than welcome to pick them up if you are interested in knowing the comments that they made on different teams besides the quantitative side. So, I mean, the sheets are available and you can just pick them up. So the order of the presentation is the one that we can see on the slide. Team number 10 will be the first one presenting in few minutes. Then the team number 5 will be invited to join. And obviously team number 10 can stay and attend and observe the presentation of the second team. And then the final one will be team number 7, which again will wear the microphone and will be invited to join. And the first 2 teams can obviously observe the presentations that will be made by the other teams. I wish you good luck. If the 3 teams can just come here, the first one, team number 10, must wear the microphone, and the other 2 teams are invited to have a coffee with our conference assistants. Thanks again for taking the time to be with us in the final round. Just to remind you of a couple of rules that you needed to bear in mind for the final round. The rules in terms of timing are exactly the same as this morning and yesterday, which means that the team has 30 minutes to finish the presentation. I will be the one taking the time. So before you're getting to approach the 30 minutes, I will tell you that 5 minutes are left. Then you will have 15 minutes to make any questions, and again, please talk in the microphone. You are requested to make your assessment on the sheet that has been provided to each of you. The conference assistants will take your sheets back from you at the very end. So when you will complete your evaluation of the 3 teams. And then, we will have the time to make all calculations and see who is the first, the highest ranked team. So good luck, and let's start counting the time from now. Okay.
Good afternoon. We're team number 10, and we're going to share with you our thoughts on this Novartis case. Just a brief overview of our presentation. We're going to start off with a description of the current situation of the pharmaceutical industry and of Novartis's position within the context of the Italian healthcare system. We're then going to go over what we found to be some best practices, not just in pharma but beyond as well. And we're going to make recommendations as to how Novartis could potentially improve and ultimately adopt some of these best practices. And then we're going to go and discuss the feasibility of implementing some of those initiatives. So the bottom line is Novartis is currently performing extremely well. We did not want to come here and suggest a completely radical change in strategy. We think that the new business model is extremely appropriate. So instead, we decided to focus on answering 2 key questions. Specifically, what can Novartis do to better understand and engage with decision makers? And what can Novartis do to establish these mutually beneficial, predictable, sustainable relationships with them? So our approach towards selecting these initiatives was as follows. First, obviously, we had to develop a fairly deep understanding of the context within which Novartis operates in Italy. We then searched for best practices across industries and countries, and then we selected the ones that we thought would be would best fit with Novartis's new business model. And finally, we tweaked and tailored them so that they would be just right for Novartis Italy.
How about the Novartis Hospital Innovation Award? This, of course, would, in terms of the activities and the actual ceremony itself, would be very similar to the Ernst & Young Entrepreneur of the Year Award ceremony. And essentially, though, the difference is, of course, the Ernst & Young initiative is directed at rewarding entrepreneurs, whereas this one would be directed at rewarding hospitals for actually using innovative means in order to improve the quality of health and the efficiency. Actually, what you're doing is you're providing and you're fostering the best practices throughout the entire healthcare system. So it's not just one hospital that's learning, because you reward it, so you acknowledge it, so you push it forward, so that it crosses across the entire healthcare system. So that's the first initiative which we propose. The second one is what we like to call the rotational exchange program. Well, you could recruit people from the public sector, or you could train them to understand the other perspectives. So one way of doing this would be to have this job rotation program, which I initially stated. It's important to note that in the pharmaceutical industry, such programs already exist. But right now, the issue is that we're trying to understand what the external perspective is. We're trying to understand how the external perspective works so that we can incorporate it with the internal. What we thought we needed to do is incorporate 4 sectors. That is pharma, the industry, academia, regulators, and providers. So how can this be achieved? This can be achieved through, well, you bring the young professionals through, you run them through a 2-year rotation program.
Well, what is something that these decision makers need? One thing they need is to develop effective strategies for cost containment. So in developing this 3rd proposed initiative, what our team did was look to see if there were settings where this has been done extremely effectively. So at this point, you're probably thinking, well, Novartis is not an insurance company, and we're also operating in a very different healthcare system. The Italian healthcare system is significantly different from the one in the US. So how can Novartis use this concept? Well, the good news is that many Italian regions and provider organizations have already started the process of collecting data. And what we think Novartis can do is find a way to use this data. It might not involve using a technology as sophisticated as the Care Engine, but what we think they can do is offer on-site utilization reviews to some of their key accounts. So our 4th initiative is what we're calling a disease management program partnership. And it's inspired by an initiative that was rolled out recently in the UK, and specifically in Nottingham community. What it was is a disease management program, and it was based on a groundbreaking collaboration between industry, the NHS in the UK, as well as the Nottingham community. And the goal was to identify the patients within this community were at the highest risk of developing cardiovascular disease.
So let's now have a look to the timelines and the resources associated to the implementation of these various initiatives. We do believe that each of them need to be incorporated over, the bigger financial, strategy that Novartis has in place. And there might be economy of scales, because for sure we know that you are already organizing big events. So the Hospital Innovation Award would just be one additional event of this kind. But we do also believe that all the initiatives that Novartis has implemented might help in mitigating the impact effect of these various issues. So just to conclude, this table is meant to summarize the set of our initiatives and to show you that all of them address the 4 main areas that were highlighted at the beginning of our presentation, with different weight depending on the specificity of each single initiative. So we would like to end our presentation by quoting an important sentence from Kofi Annan, the former UN Secretary General, where he basically highlights the importance of working together for health, not just because, for breaking barriers, but because it makes economic sense. And we would add, in the specificity of the Italian sector, also because that would help Novartis delivering a higher quality of care for all patients. Thank you.
There are very good initiatives, congratulations, but my question is, do you think that in the medium long term this kind of direction will have also an impact of the organizational setup of our of Novartis, and also an impact of the culture that people, employees, or and the attitude of the people will have, to be effective or to have a difference with other competitors?
I think a little bit of cultural change is good, particularly in terms of the utilization review. If this is not the type of activity that your key account managers are used to doing, they're not used to going on site and sitting down at a meeting and looking over data, that would require a little bit of a change in perspective. So that would, you'd have to really think about ways to build on that, to make it as effective as possible.
For me, or for the company, I think the key difference would be how we really leverage, let's say, a neutral role of Novartis, enhancing this kind of best practice sharing or visibility of 1 or 2 hospitals without, taking part of the whole story. So did you really, because I think out of the 4 is the one where I think the role of partnerships and transparency is could make the big difference, I think.
And we sort of discussed earlier on the importance of transparency and having a neutral, independent panel of judges. And again, really stressing the fact that it's not meant to be a competition, that it's a sort of a platform in which different hospitals can come and present, what the problem that they were facing, the solution that they implemented, and the results that they achieved. And it really should be sort of like I said, a platform where they can show their performance and then symbolically achieve a reward, basically.
Thank you very much.
I am Cherise from Trinidad. My colleague is Ayman from Egypt, Natalie from Germany, and Martin from Austria. We're from 4 different countries with 4 distinct backgrounds. And together we came up with a solution predicated on what Mr. Mark Neva wanted. And out of this, we choose 3 points to try and improve Novartis Pharma's public image, to bridge the gap between the fragmented healthcare system, to encourage communication, and somehow try to predict the government actions. How are our goals moving forward going to be in aligned with the government's goals? So our strategic target areas. We hope to target the public, which is civil society, the everyday person, the healthcare community, which are all the healthcare stakeholders, and last but not least, the regional health authorities. These are the people that make the decisions that impact everybody. So our first element is in keeping with the public sector, Our second element, the healthcare community, and our regional health authorities is our third element.
The areas of focus for this element will be, first of all, the image of the pharmaceutical company. As we all know, the image is almost as bad as the one from banks or insurance companies. The second area of focus for this element will be the public influence on the policy-making process, meaning the general public opinion will kind of mirror the opinion from the health authorities, because those people are elected by the general public, and they have to mirror the opinion from the general public. And so you can indirectly influence the policy-making process, also when it comes to the drug policy-making process. The next point will be that Novartis wants to show that health of a community is at the center of what they are doing. So this was also requested by the head of the marketing and sales department from Novartis. And last but not least here, Novartis wants to create a strong value proposition for the society, and this again was requested by the Chief Scientific Officer of Novartis Italy. And in order to cover all those areas, we established an initiative called Play for Keeps, and it's organized by Novartis. This initiative will aim to bring kids to sports, but also will be connected to a healthy nutrition program, meaning Play for Keeps. This initiative will be connected that during this initiative, the kids will be provided with healthy food, but they also will receive information about healthy food. And this can also be seen as a prevention strategy in order, for example, to tackle obesity, which is one of the major problems in our Western societies nowadays. And therefore, it will also be appreciated by the health authorities in the region.
So the second element of our strategy is revolving around the healthcare community. And what we mean by the healthcare community is the different players in the healthcare field. The second area of focus is the problems of the slow procedures, including the drug formularies and the things that might disable a fast market access to drugs that are already created or to the new drugs that are introduced to the market. The third area of focus is the cohesiveness between pharmaceutical companies. This element of this strategy is going to address this issue very intensely, because by communicating a cohesive and coordinated pharmaceutical industry as a whole, all of these problems of communication would be addressed sufficiently. And first of all, the regional coordination of efforts, which means that this will also address the coordination on a regional level between the different players in this field. Now, the most important thing about this is that the whole Piazza della Sanità concept has to be implemented as a cohesive and complementary effort between all the different pharmaceutical companies. So this does not carry the brand of Novartis. It's a cohesive effort that is done by all. And this is very important in order to be able to attract these different stakeholders in the field. The second thing is that Novartis, as a company which already has a number of significant initiatives and contributions, like, for example, Novartis Academy, the entire infrastructure of the Novartis Academy can be used somehow in order to implement this. So it would not require an additional infrastructure to do this. And so to conclude, I would like to say that through this Facebook-like interface of communication between these different players, the communication can really improve till the annual events where they can communicate these things more extensively. Some of you might be a bit apprehensive about Facebook for the healthcare community, but as an Egyptian, I can tell you that Facebook does sometimes really make a difference.
So the third element of our strategy is targeting the regional health authorities. And this element is all about adding value, monitoring trends, and providing predictability. Moreover, they have introduced regional formularies. So even though there is a central formulary, it takes up to 8 months or even 2 years until the drugs appear on the regional formulary. And this is a problem, especially for the innovative products, because they will be delayed. And those regional formularies also make a difference in Italy, because patients have different access to drugs throughout Italy. So how does this service look like for the hospitals? Here, for example, we are signed in as ASL Salerno from the region Campania, and we can see all the currently available products that is in the regional inventory. And if the hospital now needs a product, it can simply click on it and specify the quantity needed, and then have it shipped to their facilities in real time. So to sum up, Novartis provides added value to all of the stakeholders involved. It's a product service bundle. For the hospitals, it means that they don't need a physical inventory anymore. For the regions, it means that it's an analysis tool for better planning in the future and for better budget allocation. But also for Novartis, it provides a competitive advantage because they will be the first one and thereby can increase their market share. This service can then in the future also be taken further to include medical professionals or patients. And this can be designed around a compliance application, for example, where the patients are involved and the medical professionals then engage in this service.
Could you speak for a moment about how you anticipate being able to bring together all the stakeholders under Piazza della Sanità, and how is that, because it can't be affiliated directly with Novartis, how exactly are you going to use that to improve the mutual benefit and trust while at the same time keeping it a much more collective activity than specifically to Novartis?
Piazza della Sanità has to be created as an independent initiative. So it is better to do it in a completely separate entity from Novartis. It should not be branded with the Novartis name, and it should have the biggest amount of independence that can be done. And this should be done in a very collective way. And so we believe that in order for the other companies to believe that this tool is going to be effective for them, they have to see what addition this will bring to them. And the answer for this is quite simple. Whether we're talking about the physical format, which is the conference, or the online format, these pharmaceutical companies are going to be able to directly communicate with the people who directly purchase their products and distribute them. And therefore, they are going to be able to establish their own market access and to deal with their specific problems instantly and live with the people who really make the difference about these decisions.
Can you please clarify which is the real benefit for the patient at the end?
The regional formularies make the patient access differential in the country. So maybe somebody in the north will have a faster access than someone in the south. So by bringing them on the table, they can all discuss this issue and then also harmonize the patient access.
You mentioned the plan to go for a pilot project in region where the market access is it's easy. Did you discuss this indicator in comparison with other indicators, like, I don't know, the availability of HTA activities or something else? Why did you choose easy situation for market access?
We chose the region Campania because Novartis Pharma has a manufacturing plant there, and this would at the beginning make an easier access for the pilot project. But on the other hand, there are also the regional formularies, and there is this collective purchasing of the drugs in this region. And so this region is under cost pressure, and it also has a relatively high time until the products are included in the regional formulary. So there we can really assess whether our strategies work in this region.
To have its drugs put in different formularies, they have to go through a very diverse set of actions and twists and lobbyings and meetings, and these efforts are only dependent on the kind of person they are dealing with. There is no sustainable and precise way of actually having this market access. We have a central government that puts general strategies, regions who make the decisions, local hospitals, physicians who influence the decision of the local hospitals. And therefore, having all of these people sitting on the same table, it would make the equation much easily solved. What's happening right now, it's as if the pharmaceutical company is standing in the middle trying to solve problems with different stakeholders, and each of them is staying in his own house. If all of the parties are just sitting there, it's going to be solved in no time. And this is quite important. I believe the biggest problem is communication.
We think that we will be able to offer some ideas for enhancement of this strategy via pursuit of a closer alignment of Novartis with all of the major decision makers in the modern Italian healthcare system. We think that we can offer some ideas that will solidly position Novartis as a trusted partner in healthcare. The company's mission is to discover, develop, and to successfully market innovative products that will prevent and cure disease, that will ease suffering, and will also enhance the quality of life. And this is done while providing a shareholder return that reflects outstanding financial performance and also adequate rewards to those people who invest their ideas and their labor into Novartis. Finally, in addition, there are economic factors that we must deal with. there's a slowing growth rate for pharmaceutical sales that is occurring all across the industry currently. There is significant pressure on the National Italian Health Service as well as the local health services to control cost, with drug spending being a primary target of these cost controls. The company has a very strong and active, well-financed research and development department. This allows for its drug pipeline to stay vibrant and active. Also, Novartis has established partnerships with several major Italian universities. This allows the company to have more access to technological advances and also access to the technology workers that are being developed by these universities.
So we first started by trying to identify who the major stakeholders were and how we should approach them. Clearly, physicians, community, and government fell into those categories. Education, honesty, and alliance pertains to all of them. People have to know what you're doing. They have to feel comfortable with what they're doing in order for a program to work. Honesty is critical. Drug industry has a little bit of a little rough time in Italy, and a lot of places actually, and we have to portray that we are honestly concerned about what we are doing, and that this is an alliance. This is an alliance between Novartis and the stakeholders. The strategy is that we demonstrate that we strongly believe in that, and that patients and providers are going to be very interested in joining a program we call One Novartis. Our concept was, right now, patients and everybody is stuck on this side of the big bureaucratic wall, and trying to knock down these bricks and get through this maze is very difficult. So instead, we're going to jump it right to the patients. The patients are then going to help us break down that regulatory environment wall. What we do want to do is design the program as part of the idea of the triple aim of the Institute for Healthcare Improvement in order for its maximum success, which states the improvement of the health of the general population, to enhance the patient experience of care, and to reduce or at least control the per capita cost of care. And again, per Dr. Vasella, Novartis too can make social progress a reality rather than merely an empty phrase.
If we look at the benefit to Novartis, we see that it can improve Novartis' image as well as the image of the pharmaceutical industry that has been tainted the last several years here in Italy due to scandal. We see that there's a financial advantage to having contact information on every patient within Italy, and also a financial advantage to having every patient, providers, and regional governments involved with Novartis in improving the health within the Italian population. What Novartis has done is employed a very innovative approach in creating these drugs and treating diseases. We want the One Novartis program to be committed to collaborative approaches to enhance the quality of care, improve the patient outcomes, and reduce cost. We'd also like One Novartis to collaborate with institutions that have excellence, and we believe one of those is located here in Milan, Italy, the European Institute of Oncology, IEO. There they have excellence in clinical practice, research development, and training of healthcare workers. We want their ideas of prevention, diagnosis, and treatments of cancer, utilizing cutting-edge research and also effective management, to be emulated with the One Novartis program. And I've listed the values and principles there, which is on their website itself. And we want the One Novartis program, with the tethering of medications, getting the preferred formulary access, to be the generic brand that they will transfer into when the brand name comes off patent. We also want One Novartis' metrics to follow the quality indicators and outcomes that are standard worldwide for congestive heart failure, CHF, or coronary artery disease, CAD. We'd also want Novartis, which we know is a leader in drugs with very niche diseases that we talked about, the CML previously, diseases with very little hope, now have profound hope. We believe that collaborative approach can bolster the industry, but also bolster the One Novartis program.
Our economic theory is based on three things. By offering discounts, Novartis gains a large increase in market share, a naturally respected and admired brand name, and a reputation for national health advocacy, which is paramount in this program. If we add a 5% discount to the 2010 numbers of $1.9 billion, we now come up with a new discounted price of $1.8 billion. Now, if we take the total sales with discount and the new market share of just 1%, that goes up to $1.99 billion for a net additional profit to Novartis of $86 billion. $million. The benefits of One Novartis: patients and regions get discounts, the most important thing. Novartis gets a preferred access to formularies. Novartis increases its market share, and Novartis gets the good name. Novartis takes care of the community, and most importantly, Italy gets healthy.
So basically, which is the value of the new drug you're launching into the market if you make a huge leverage on discounts in your strategy?
I think I understand what you're talking about, which is if you offer you've negotiated your price, and now you're going to offer a discount aside from that price to a subset of patients, which is exactly what we're doing. And does it change the value proposition of this is the drug's worth and this is the drug's price? I think what we're doing is it's not as simple as discounting. It's a discount in exchange. It's a discount in exchange for wellness. And I think that changes the whole question. We're not just offering money off. We're saying if you get healthy, then we're going to help you by discounting. And I think that's a little. I think it's a little bit different than just a straight discount.
I think the proposition is very interesting because it makes people responsible on the health. And the agreement probably with the regions, not with the government, because don't touch the price, price is one, then that's it, is maybe in the area of screening, diagnosis, so helping regions to treat more patients. I mean, the idea I think is very interesting, but by the way, you succeed to treat more patients because you make the screening, you make the diagnosis, you make an appropriate prescription and drugs to that patients.
I think what we were looking for was the concept of the discount. I mean, yes, we come from a system where a discount gets people's attention a little bit more, was the concept of this tangible reward. We want to do something that makes people want to enroll, and we thought a discount for whatever they paid for, some type of reward, and that I think works out perfectly if we get just trying to get patients enrolled in a health wellness process. Thank you. Thank you. Thank you.
The final team, the highest ranked team, I would like to spend a couple of words to thank you all for this very exciting experience. We all are very excited and are very proud of all of you because we do think that we have done a great job. We really learned a lot and I think that we will bring home a lot from this case competition, which behind the competition itself has been a great opportunity for each of us to get acquainted each other. I do hope that tonight, at least myself, I will have more opportunity to get to know people I couldn't get to know yesterday. So I think that the real value is actually there. And I do hope that in the following years, this competition can be spread and can welcome your schools and hopefully even additional schools.
I think it was really not easy to take the final decision, but beyond, let's say, the final scores, what I wanted to share with you as a company is that at the end of the day, we worked, I mean, different projects, different ideas, but I really saw a sort of fil rouge among the projects, a sense of partnership that all the teams developed in their projects. And this is, at the end of the day, the scope of the Academy of Healthcare Management and Economics, which is the basis of this partnership with Bocconi. It's important that we, I mean, really join the same objective of working not as, let's say, a Babel tower, different languages that do not match together, but we have the same language, the same objectives. So this is part of the Novartis mission, and this is also in view of, and I look here at my colleague from the Human Resources, of the Novartis mission in terms of building new skills, expertise in healthcare, really to reach these common objectives. So.
The Executive Master by Auburn University, Alabama, United States, and the MBA by MCI Management Center, Innsbruck, Austria. It was a great pleasure. Congratulations. Congratulations. It was a great pleasure. Congratulations. It was really nice to have you here. It was really nice to have you here. Thank you. Thank you. It was a real pleasure.
Thank you.
Thank you. It was really very nice.
Thank you very much.
Thank you. Thank you. It was really nice to have you here. And now, finally, the winners are the first students from Master MIHMEP at SDA Bocconi School of Management. Before leaving you, let me acknowledge once again with my most sincere heart all my colleagues, Joanne Matthews, Aisha Mikalak, Alexandra Torbitz, Amelia Compagni, and Paolo Fedele, because without them I would be hopeless.